This is part one of my virtual checkoff. My mom is going to be my patient for me to practice my skills on. We're going to start with the range of motion. We're going to do active and then passive. It's important to assess your patient's range of motion on evaluation so that way you understand how, where they are at the current presentation, and then you can make goals based off of where their limitations are. And it can also help the physical therapist understand what structures might be causing the lack of range of motion. So we're gonna start with flexion. So I'm gonna instruct my patient to touch her chin to her chest. I'm gonna line up the stationary arm parallel with the floor at the level of her C7. And it's going to line up with her ear. And I'm going to ask her to perform the movement. So go ahead. Good. And normal range of motion is 80 degrees. And she went to 72. So then next we're going to do extension. So same positioning of the goniometer. And she's going to bring her chin as high up as she can. And normal range of motion for this movement is 80 degrees, is 70 degrees, and the patient went 65 degrees. So next I'm going to ask my patient to turn around so we can look at the back of her neck. And we're going to do lateral bending. So I'm going to line my goni. It's still going to be parallel with the floor. And it's going to be at the level of her C7. I'm going to use my hands to help keep her from using her shoulder to increase her movement. I'm going to ask her to bring her ear to her shoulder. So go ahead and do that. Good. And normal range of motion for this is 20 to 45. And she made it 30. So then I'm going to do the same but the opposite side. So I'm going to hold her shoulder so she doesn't cheat. And go ahead. Good. And you made 25 on that side. So the last movement for the active assessment is going to be rotation. So I'm going to be standing above the patient. The axis is going to be straight above on the top of her head in line with her neck. And then stationary arm is going to be perpendicular with her body, and the moving arm is going to follow her nose. So go ahead and you'll turn to your left first. Good. A normal range of motion for this is 70 to 90, and she is at 60. And then go the other way. And then for her right rotation was 70. So that completes our active range of motion assessment. So now that we're done with the active range of motion, we're going to do passive range of motion. So I'm going to start by bringing the patient into flexion. Good. And I'm going to apply overpressure. Does that cause any pain?
No.
Okay. Then I'm going to bring her into extension. Does that cause any pain?
No.
And then overpressure. Is that okay?
Yes.
Okay. Then we're going to do the lateral rotation. So I'm going to bring her ear down to her shoulder. Does that cause any pain?
No.
Right. And then I'm going to apply overpressure. Is that okay?
Yes.
And then I'm going to do the same but the opposite side. Is that okay?
Yes.
And then overpressure. Does that hurt?
No.
Alright. And then last we're going to do rotation. So I'm going to move her to the side. Does that hurt?
No.
I'm going to overpressure. Is that okay?
Yes.
And then we're going to go to the other side. Is that okay?
Yes.
And then overpressure. Is that alright?
Yes.
Alright, so that completes our passive range of motion assessment. So now that we're done with the range of motion testing, we're going to move on to her manual muscle testing. It's important to assess her muscles during evaluation so you can understand if there's any painful movements, that a stretch might be causing the pain, so maybe like a muscle strain, or to see if there's any weakness, so that way you can understand what could be contributing to her symptoms and why she's in your physical therapy clinic. So what we're going to do is I'm going to ask the patient to flex her head down, so touch her chin to her chest. But I'm going to, here, let's restart. But I'm going to ask her to do that while applying resistance, so go ahead. Good. And then I'm going to ask her to do the same, look up. Do you mind if I put my hand on your chest? All right. So I'm going to ask her to look up, and we're going to resist it, so go ahead. Good. And then I'm going to ask her to put her ear to her shoulder, but I'm going to resist it, so go ahead. Good. And then same on the other side. So go ahead. Good. And then I'm going to ask her to rotate her head to her left, and I'm going to resist, so go ahead. And then the other way, so go ahead and rotate. Good. Did any of those movements reproduce your symptoms?
No.
Good. Our next assessment will be of her dermatomes. So a dermatome is an area of the skin that has cutaneous sensation from the spinal nerve. So it's associated with a specific level. And it's important to assess her sensation to know what level might have a lesion or might be compressed, to help us understand where exactly in the spine she might be having symptoms. So what I'm going to do is I'm going to ask my patient to close her eyes and look away. It's important to assess the unaffected side before the affected side, so you get a baseline before you see where her impaired side might be. So I'll ask her to look away, assuming her left side is unimpaired. And I'm going to touch her body in a way, in certain areas, to assess if she can feel me. So I'll ask, tell me when you feel my touch.
Yes. 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 Yes.
Okay, so you can look this way, and this time I'll tell you which level I'm assessing at the time. So this is C5.
Yes.
This is C6.
Yes.
C7.
Yes.
C8.
Yes.
And T1.
Yes.
Alright, so now we'll do the lower extremity. So same, I'll ask her to look away before, and I'll start on this side. So do you feel this?
Yes. 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 Yes.
Good. So again, on this side, I'll tell you which level I'm at. So this is L2,
Yes.
L3,
Yes.
L4.
Yes.
This is also L4,
Yes.
L5,
Yes.
and then S1 is the heel.
Yes.
Alright, so that's the end of our dermatome testing. Next we'll do myotome testing. So myotome is the partner of dermatome testing, except it's muscle strength rather than sensation. So again, it's a group of muscles that is innervated by a specific spinal level. So testing the muscles can help us identify what part of the spinal level, what part of the spinal nerve could be compressed, and also where it could be compressed. So I'm gonna check her arms first. So abduction is C5, so I'm gonna ask her to resist. Good. C6 is tested with elbow flexion and wrist extension. So I'm gonna do elbow flexion first. So yep, hold that position. I'm gonna pull out. Good. 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 And then also wrist extension. So I'm gonna ask her to hold her wrist into extension. I'm going to try to push it into flexion. So yeah, hold that. Good. Good. And then C7 is extension with wrist flexion. So I'm going to have her break it. I don't want it to be locked out. So relax a little bit. Yeah, bend a little bit more. So I'm going to ask her to try to straighten while I'm pushing up. So go ahead. Good. Let's see. Good. And then the wrist flexion. So she's going to bend her wrist. And I'm going to try to straighten it. So try to keep it like that. Good. So bend it. And I'm going to try to straighten it. Good. And then C8 is responsible for finger flexion and thumb abduction. So I'm going to test her. She's going to give me a thumbs up, and I'm going to try to push it down. So keep your thumb up. Good. And keep your thumb up. Good. And then T1 is finger abduction. So I'm going to ask her to put her fingers like this, and I'm going to try to push them in. So keep them out. Good. 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 So that's the end of the upper extremity myotome testing. So now we're going to test her lower extremity myotomes. So first she's going to lay down. We're going to check her hip flexion. So that's L2. So I'm going to position her into flexion. I'm going to ask her to hold this position, and I'm going to try to push her out of it. So go ahead and hold. Good. And then other side. Try to hold. Good. So she's going to sit up. I'm going to move this chair over, and we're going to do the rest of her lower extremity. So go ahead and sit down. So that was L2 is hip flexion. So now we're going to do knee extension. So she's going to try to straighten her leg while I try to bend it. So yep. Good. Other side. Try to extend. Good. So then next we're going to do dorsiflexion. So you're going to try to bend your toe up. I'm going to try to straighten it. So bend up. Yep. Good. And then bend up. Good. So then we're going to do big toe extension. So that's 5. L5 is big toe extension. So bring your toe up. Good. Bring it up. Good. And then S1 is plantar flexion. So this time you're going to try to point your toes, and I'm going to try to pull you up. So go ahead. Good. So point your foot. Yep. Ooh, nice pop. Good. So that's the end of the myotome assessment for her lower extremity. The next part of the checkoff is going to be assessing vital signs. So it's important to make this assessment when you're first meeting a patient so that you can have a better understanding of their cardiovascular health. We're going to be doing exercise in physical therapy, so it's important to understand if it's safe for them to perform those exercises or not. Another thing to consider would be if the patient hasn't been to a primary care physician within that year, or has increased risks for high blood pressure or heart diseases. Those risks could be family history of heart disease or personal history, increased age, and lifestyle choices, including smoking, drinking, or if the patient is obese. So some vital signs that could be beneficial to check would be blood pressure, heart rate, respiratory rate, and then if you have a pulse ox, you could also see CO2 so that you understand how their body is utilizing the oxygen that they're taking in. So we're going to do blood pressure. So what we're going to do is we're going to place our cuff so that the artery, the brachial artery, is lined up with the arrow. And yeah, you want the patient to relax. One thing that's important to consider is when you would take the blood pressure. So having the patient rest and sit without crossing their legs for about 5 minutes at least, so that way you at the beginning of your treatment or evaluation session, so that way you know that their body is truly at rest, because before they enter your clinic or into your assessment room, they might be running around or rushed late, something like that, that would elevate their blood pressure. So to get a good, true reading, it's important to have them sit and relax and not talk for a moment, about 5 minutes, just so it's more accurate reading. So then you're going to take our stethoscope. It's important to check to make sure the right side is on if you have the dual head. And I'm going to place this on the artery, and I don't want to use my thumb to push it down, so that way I don't have interference with my own heart rate. So you have to make sure the gauge is facing you, and I'm going to pump it up. Typically, if the person has an understanding of their blood pressure already, you would do 30 millimeters of mercury above that, but I'm going to go to 180 to start off, and then we'll see if that's high enough for this patient. So this patient's blood pressure was 122 over 72, which a normal range would be anything that's systolic is below or equal to 120, and the diastolic is below 80, so she's within a normal range. And that's it for assessing her blood pressure.